following interview involves commercial content. The products and services featured appear as paid advertising.
Recently, the Wall Street Journal reported that over 16% of Americans suffer from chronic headaches and another 15% have chronic neck pain. More than 45 million Americans suffer from headaches and migraines. Is there hope for these people? How can looking inside your mouth, how can that make a difference? Dr. Charles Barretts with Barretts Dental joins us once again to answer more of the questions that you might have. So is there really a safe therapy for headaches, migraines, jaw pain, things of that sort?
Well, I've been treating headaches for my entire career, and there's been a new therapy called TruDenta therapy that is miraculous, giving us, with proper differential diagnosis, success in about 95% of the people that have come into us who qualify. It basically incorporates techniques into dentistry that are in sports medicine, muscle manipulation, as well as balancing the bite, as opposed to just dealing with the symptoms. In TruDenta therapy, without needles, without any surgery or any drugs, we have been very successful at helping people who are serious migraine sufferers, TMJ sufferers. It can even help people with tinnitus and vertigo. It's an amazing therapy with amazing results.
It's amazing just how you think about your jaw can affect all of that.
Well, we'll talk more about that when we talk about you know, the nerves. But
I'm excited to hear about this. I'm getting ahead, huh?
Okay, yeah, exactly.
but first, we want to hear from one of your patients, and they're usually the best testament.
This is Carrie, and Carrie's life was completely changed. Look at her eyes when you see her before video and her after video. Look at her whole expression in her face.
Let's take a look.
I had to take 2 Maxalt yesterday and 3 anti-nausea pain medication. You know, and it's tough. I don't remember normal at this point. You know, for 8 years, I don't know what normal is anymore. It's very emotional. I mean, I could cry. I'm not sure how to describe how it would be to be pain-free at this point, because it's been so long that I haven't been. I'm sure I will look forward to it and enjoy it the best I can, and enjoy life. I mean, that would be wonderful. So it was probably the 8th week that we began to see improvement. Well, it's interesting because I wake up and I anticipate a headache. You know, and I'm almost afraid, but there's no headache. And it's wonderful. It's just really nice. I think it's important to note that on 3 occasions I came in with headaches, and they were on their way, anywhere from 4 to 5 to 6 level. When I walked out, they were gone. Yeah, and it's due to the caring, the compassion, the trust, and support of Dr. Barretts and his staff. I feel really, really happy.
Dr. Barretts, she was in a lot of pain.
Her life was changed. I mean, she now goes out dancing. We've had patients who had to leave the Broncos AFC Championship game because the wife left with a headache. We were able to help that person as well. These are life-changing treatments. This is what's so exciting about it to me.
So does, you know, listening to her, how does the bite, how you bite, affect that?
Oh, absolutely, Tanya. You know, what is overlooked by most caregivers is that almost all of these headaches have a dental component, and that all of the nerves that involve headaches also are innervating the teeth. So an imbalance in the way the teeth come together can trigger these headaches, but it's not quite that simple. There's usually a history of trauma that needs to be dealt with, and something else that causes these problems, like limited range of motion, trigger points, and adhesions. All of these are dealt with in the dental realm in the TruDenta therapy.
So some of these symptoms then with this new amazing therapy is it's getting rid of those migraines and headaches and gets rid of everything.
Well, what is little known is that 70% of all migraines are misdiagnosed temporomandibular joint problems. We can treat symptoms like chronic headaches and migraines, TMJ, head, neck, face pain, and in some cases vertigo and tinnitus will disappear. We don't expect that to happen, but it has happened. And limited range of motion of the jaw, head, or neck. Most of these patients can be helped.
So I'm thinking, you know, it sounds so extreme and so excruciating with that. What could have caused something that bad?
Well, usually it can be traced back to trauma of some kind. You know, people have to think back, like
Car accident?
Car accident, young women who played soccer.
Sports.
Well, particularly women whose necks are not set up as strong as men. Sorry, it's not a sexist remark, it's just a fact.
Right.
And as they're young and they're doing these headers, they're actually getting problems in the muscles of the neck that continue, and even mini concussions. So the reality of the situation is, after they've been thoroughly through the medical realm, they're looking for hope. They come to see me, and this therapy is truly truly revolutionary. I mean, I'm in practice for 34 years, and there aren't many things that get me excited. I've had a wonderful, wonderful run in dentistry with bonding, with implants. It's been a golden era in dentistry. But this is a new thing, a new application of my dental skills, and a new ability to help people who are suffering. So if you're suffering from headaches and have lost hope, I mean, call us. The screening's only $99. We'll check your bite on a digital bite analysis, bite analyzer. We'll check the range of motion of your neck, and we'll be able to tell you whether this therapy can help you. We do turn some people away, but not most people.
Well, it doesn't sound like it. Well, this is wonderful, and I can't wait to hear about some of the other patients that, you know, when you come back and visit us. So that's wonderful.
So, and I really thank you for having me, and I just want to let anybody out there know who might be afraid of the dentist that we also do sedation dentistry.
Oh, good. Okay.
We also do sedation dentistry. If you know, what would be better to come in, take a couple of pills, go to sleep, have your dentistry done when it's all done. So we're going to take care of you whether you have a headache or any other dental needs. We'll take care of you, and we'll take care of you with compassion.
And I know you will.
That I promise to everybody out there.
Yes, and you will do that, your entire team at your office. So to find out if TruDenta therapy can help you, the diagnostic process is pretty quick and it's painless. You have nothing to lose but your pain, so you can have your full life back. You saw Carrie in the video. The Denver Headache Center is the only place in Colorado offering this therapy. For a limited time, headache sufferers can call the Denver Headache Center right now to set up a $99 screening appointment. That could change your whole life. The number 303-532-1151, or visit online at denverheadachecenter.com. Here's that number again, 303-532-1151. Barrett's Dental sponsored this segment.